Hello and welcome to PACE Medical Channel. A recent large-scale study published in the Laryngoscope Investigative Otolaryngology journal has highlighted a significant association between the use of proton pump inhibitors, PPIs, and the increased risk of hypocalcemia, both short-term and long-term, after thyroid surgery. Thyroidectomy, a common surgical procedure used to treat thyroid cancers and large goiters, often carries the known risk of postoperative hypocalcemia. This condition may arise due to accidental damage or reduced blood flow to the parathyroid glands during surgery. According to the literature, the incidence of temporary hypoparathyroidism after thyroidectomy ranges from 0.3% to 49%, while permanent cases range between 0% and 13%. Meanwhile, PPIs, widely used for conditions like GERD, gastric ulcers, Barrett's esophagus, and H. pylori infections, make up around 5 to 10% of all prescriptions, with usage on the rise. Previous studies have already hinted at a link between PPI use and post-thyroidectomy hypocalcemia, prompting this current research to investigate the prevalence and severity of this association further. Using data from the TriNetX Research Network, researchers analyzed over 33,000 patients who had undergone total thyroidectomy between 2012 and 2022. They compared patients who were on PPIs to those who weren't, looking at rates of temporary hypocalcemia, 0 to 6 months, and permanent hypocalcemia, 6 to 12 months, post-surgery. Here's what they found. 21.3% of patients had been prescribed PPIs before surgery. At 0-1 month, hypocalcemia was reported in 50.9% of PPI users versus 48.3% of non-users. At 6 to 12 months, the rate was 70.6% among PPI users and 72.2% among non-users. Across all time frames, 0, 1, 1 to 6, and 6 to 12 months, PPI users consistently showed a higher likelihood of hypocalcemia. Additionally, emergency department visits due to complications were significantly higher in the PPI group. Although hypocalcemia often resolves on its own after thyroidectomy, this study suggests that PPI users might be more vulnerable to persistent or more severe forms of it. The takeaway? Physicians should consider a patient's PPI use as a potential risk factor when planning thyroid surgery and managing postoperative care. Further studies are essential to understand if reducing or modifying PPI use can help bring hypocalcemia risk back to baseline.